Thank you very much for participating in this interview. For those of you in the audience, I'm talking to Gill Holman, who's a vascular patient from Cambridge. I really wanted to speak to you, Gill, because I wanted a patient's opinion about the direction of travel for some of the Circulation Foundation's strategies for the years to come. I've always felt that the Circulation Foundation should be a patient advocate, and we should do things to help you. Up to now, we've used our fundraising to fund research predominantly, but I was wondering, you know, from a patient's perspective, where you think we should be using our money for best effect.
Well, hello, and nice to talk to you. I'm thinking that if and when I end up in waiting rooms in hospitals or at the chemist or at the doctor's, I look around on the walls and there's leaflets that talk about heart disease and diabetes and cancer. There's nothing on there about vascular disease. And I'm thinking that people who have perhaps got nothing to do other than sort of look around, they might pick it up and say, oh, what's vascular disease? I've never heard of that before. Why haven't I heard it before? And why is there a leaflet? Pick up the leaflet and then suddenly realise that actually, oh, that explains why I have a pain in my leg. Perhaps I ought to get it checked out. And I think that reaching out, even if it's just on a small scale, make sure that there's a publicity in and around the areas where people are most likely to be suffering from vascular disease are attending. I'm pretty sure that sort of a big jazz hands type television campaign is going to cost thousands and thousands and thousands. So I think if you start small and try and then generate more funding with knowledge, that's going to be the way forward. I'm not sure if you have the resources to even to fund a nationwide leaflet campaign, but I think that's got to be the way to start. It's important that people who don't know about the disease get to know about the disease.
So as a patient, do you find it frustrating that vascular disease is the very poor cousin to heart disease and diabetes, which gets a lot of promotion?
Absolutely. I have to explain my disease to everybody, well, not everybody, but if people ask me what's the matter or how are you, or you get into conversation about things like your health, I have to explain vascular disease. No one knows what it is. Very few people, they know what heart disease is, but they don't really understand that vascular disease can affect all parts of the body, especially the legs and your carotid. It's a mysterious disease to 95% of the population, I think. Interestingly, it's the biggest killer no one's ever heard of, as they say. And I think
I love that line. It's true. It's very true. And I know, so thank you very much for your idea of the body walk earlier this year. We've been very much hoping to use that as a campaign for the rest of the year to try and educate people about vascular disease. Yeah. And that's something that we can do on the website, but I wholeheartedly agree with you about the leaflets and the starting simple and putting it in places where patients will read it and try and get the word out a bit more clearly. I think that's really important. Just sticking with sorry, you're going to say something?
I'll just add that it also, I think, making people in the medical profession a bit more aware of it as well. I think there's a real attitude towards vascular disease that is, I did my 3 weeks on vascular and that's it, and that was 10 years ago and nothing's changed. It does seem that a lot of the medical profession aren't up to date with the current thinking about, it's just, they just don't, it's not sexy enough for them to take any notice of, it seems to me, because I have to explain it to nurses and doctors sometimes. exactly what's the matter with me. And that does seem a bit strange.
Bit frustrating. I can understand that. Good. Okay, so one of our strategies then is going to have to be some promotion and some advertising and some general information that goes out. So we will put together a strategy about that. I suppose the other thing that I get asked all the time is, how can we use the website to help you? What would you like as a patient to see on the website? What would be helpful for you?
I think now, this is quite controversial, but I actually think honesty is the big part, because looking for information about how you deal with vascular disease, there's a lot of very, very useful information about walking and diet and health and stopping smoking and all of that. Now, chances are someone with vascular disease is initially going to approach the website and think, right, that's that information, I'll do all that. But it doesn't always work out for you that walking and stopping smoking and eating, cabbages all the time is going to make you well. And so going on from that, there's very little information for a patient who's gone past that initial round of the primary advice. So if you've had the primary advice and it hasn't worked out for you, where do you go next? So someone like me, I'll end up Googling medical websites, and then it gets scary. Well, it gets scary because I wasn't, when I needed to find out information about what was going to happen to me, it did get scary because I had no idea that the disease can be that severe. It can be a limb losing, life threatening disease, because no one talked to me about it initially. And I think it again, it's knowledge. I mean, if I, for example, had, I don't know, breast cancer, I would have in my head, because I know about breast cancer, I'm aware about breast cancer. I would have an idea of the trajectory of the disease, that it's, I might be lucky and get cured. I might have to go through a painful time, but the rates of cure for breast cancer are good, but there is a possibility I might not be. And you approach it with that information. When you've got vascular disease, you don't know what the trajectory of the disease may be. I'm finding it's to find information about that very, very hard. So I think a bit of honesty about what can happen when you've got vascular disease, it would, for me, it would be very useful.
What about us sort of outlining the types of treatments and things like that with an interview with a clinician? Would that be helpful?
It would be very useful, because it says somewhere you might have angioplasty. Unless you know what angioplasty is, then you think, what's that? It would be useful to have a layman's description of how and what happens when you have angioplasty, or what happens if you have to have a fempot bypass or something like that, or whatever. Yes, it would be very useful.
And when you're interacting with the website or a website, what do you find the most useful? Written stuff or videos or interviews? Or
I think primarily written stuff with perhaps interviews and pictures to back up the information.
Okay.
That way around, rather than just pictures, because I like to know where I'm going from the words. Then go, rather than just take a risk on a picture or a video. That's a generalization across all websites, but I like to have the written information. But I'm that sort of person.
What about other patient experience or stories? Does that help you?
Yeah, absolutely. That gives that. I find looking at videos of other patients and their experiences, actually it does stop that. Sometimes you get a sense of isolation, that you, because it's not a very well known disease, you get the feeling that you're the only one suffering from it. And actually seeing other people who are having the same experiences as you, I don't want to say journeys because I don't like that, but the same experiences as you, it does really help to make you feel less isolated. And I think actually, you know, I do belong to quite a few of the vascular disease Facebook groups, and it does give you a sense of community, and that other people are dealing with what you're dealing with, and actually a lot of people are suffering 10 times more than you are or I am, and that sort of tends to make me think, right, come on, get on with it, you know. It could be a lot worse. Be grateful for what you have got, you know. So it does help me a lot. So a sense of community, people's experiences, and some real helpful factual information.
Okay, that's very useful, and those are things that we can do and achieve. So hopefully we can improve the content on the website to help you. Yeah, and I'd be grateful for any feedback once we do it.
Absolutely.
Thank you very much. I think that's probably a good amount of information for everybody.